Welcome to the Dibble Institute's October 2023 second Wednesday webinar. I am Rachel Savasic-Luxton, the Director of Research and Training here for the Dibble Institute, and I am thrilled to have you joining all of us here today for our webinar, 3 years later, the impact of Relationship Smarts Plus on youth in Georgia. We're honored to have Drs. Julia Alamillo here and Elizabeth Doran joining us as our presenters, and I'll introduce them in just a moment. But before we do, I want to go over just a couple of small housekeeping things. So if we go to the next slide, you'll see just some technical, like we said, housekeeping stuff. If you're having a hard time hearing us, we do recommend that you either call in using the phone number included on the email invitation that you received for today's webinar. If that doesn't work, or if you want to try using your computer again, you can also sign out and log back in. That usually solves the issue. It's kind of like doing the reboot, the usual thing when technology doesn't work. We will have about 10 to 15 minutes at the end for some Q&A. So if you've got questions, you can either submit them kind of as we go along, but no, they won't get answered until the end, or you can wait until we get to the end and submit them in that questions box to the side of your control panel. The other thing is there will be a recording of today's session, including the slides, and that will be posted and available several days after the webinar, and a link will be sent out to everyone who is here who registered for the session. So that's the housekeeping stuff. Another thing we want to do is to give you a little bit of a background about the Dibble Institute for those of you who may be newer to us and wondering how we got our name. On the slide here, you're going to see there's a picture of Charlie and Helen Dibble, and they are the founders of the Dibble Institute. Charlie did a lot of work during his retirement with young people, and he saw a lot of them having difficulties with their relationships, and also saw that when their parents were having challenges in their relationships, how that impacted the youth that he was working with. So he had this brilliant idea as an engineer, Mr. Fix-It, to translate research into teaching tools that then could be made widely available to youth. So while the Dibble Institute is not a direct service provider, we do develop research-based practices and make them available for wonderful folks like all of you who are joining us today who do the great direct services work, which leads us to the next part. Dibble Institute is a national independent nonprofit organization. We have clients in all 50 states who are providing direct services, and honestly outside of the states too, which is really exciting. And last year, when we are looking at our conservative estimates, we believe that our clients have reached over 126,000 youth based on materials that were purchased. So we just want to take a moment to honor those of you who are doing all of the important work with young people, and we're just very thankful for that. So in addition to kind of who we are, is really important to us is our mission, because that guides the work that we do. And our mission is to help young people successfully navigate their intimate relationships through important information that helps build their knowledge around relationship building and skills-based practices. We know that having conversations around healthy relationships with young people really pulls a lot of levers. So that's pregnancy prevention, dating violence prevention, mental health, job readiness, and even more. And in addition to our mission guiding our work, we also have our values, our core values that guide the work that we do and the decisions that we make here at the Dibble Institute. And I think the first one that we're going to see on that next slide shouldn't be surprising considering who we have presenting today. We believe in research. So we're big believers in research. All of our programs are research-based, and we continue to strive for evaluations on our programs to demonstrate their impact and their effectiveness. And that also means that there are updates made to our programs as we learn new information, and we'll talk about that as we kind of get into some of these later slides. The next core value that guides the work that we do is that we believe in safe, stable, and healthy or nurturing families of all different formations. And this is our goal for young people, that they are raised in these families and move on to have these families for themselves as they kind of navigate into adulthood and even their teen lives. The other thing that guides our work, or other core value, is that relationship education is for everyone. All of us can improve our relationships, and we make sure that our programs are reflective of that. So that's a little bit about the Dibble Institute, but on to the real reason of why you are all here today is, like we said, the findings, the impact of Relationship Smarts Plus on youth in Georgia. So I want to do a little bit of a background of our presenters. So Dr. Alamillo is a senior researcher at Mathematica with an expertise in social programs for families and youth. She uses quantitative and qualitative methods to examine programs and policies related to healthy marriage and relationship education, responsible fatherhood, pregnancy prevention, and child welfare. She served as the site leader for OPRE's Strengthening Relationship Education and Marriage Services Project, so the STREAMS project, which is what we'll be talking about today. And within that work, she worked on a series of impact studies to evaluate the effectiveness of relationship education programs for youth in high schools. Currently, she's the project director for OPRE's Framing Research Project, and before joining Mathematica, she received her doctorate in sociology from the University of Wisconsin-Madison. So that's a little bit about Dr. Julia. And then Dr. Doran is a researcher at Mathematica as well, with expertise in public policies and programs that support children and parents. Her work primarily focuses on childcare quality, access, and support services using quantitative methods to examine the impacts and effectiveness of programs and policies. She currently leads analysis of data from OPRE's Family and Child Experiences Survey. And prior to joining Mathematica, she received her doctorate in social policy and policy analysis from Columbia University and her master's of arts in social service administration from the University of Chicago. So with that, I will go ahead and turn it over to the two of them to present their findings from the STREAMS project.
Thanks so much, Rachel. Can you hear me okay? Perfect. So I'm so pleased to be here today to share findings from an evaluation that we conducted on the longer-term impacts of the Relationship Smarts Plus curriculum. As Rachel just said, I'm joined today by one of my colleagues and co-author on this work, Liza Doran. And Rachel, who just introduced us, is also going to jump in to present on the details of the Relationship Smarts Plus curriculum. So before I get started, I would just like to take a moment to acknowledge the agencies that funded this work and partnered with us on this project. The findings that I'm going to present today were part of a study that the Administration for Children and Families, or ACF, funded in 2015. The study ran through 2022 and was managed by the Office of Planning, Research, and Evaluation. We also partnered with another research organization, Public Strategies, to conduct this work. So that explains all of the logos on the bottom of this first slide. Next slide. So what's on the agenda for today? I'm going to begin with a little bit of background on the project that the study was a part of, which was called the STREAMS evaluation. Next, I'll share some motivation for the study that we conducted, which examined the longer-term impacts of the Relationship Smarts Plus program in high schools. After that, I'll share details of where the study was conducted, and Rachel will share some information about the curriculum. I'll then share how we designed the study, including who we selected to be a part of our sample, and how we approached random assignment, how we went about collecting data for the study, and the outcomes we examined. After that, I will turn it over to Liza to share our key findings. And then finally, before we wrap up, we'll share our thoughts on the implications of our findings for future relationship education programming for high school students. Next slide. So what are federally funded healthy marriage and relationship education, or HMRE, programs? I'm going to go through this slide quickly since I have a feeling most of you in the audience already know. But since 2005, Congress has dedicated funding to HMRE programs through competitive grants administered by the Office of Family Assistance, or OFA, within ACF. HMRE programs aim to support strong, healthy, happy families by teaching information and skills to help young people and adults form and maintain high-quality romantic relationships. Next slide. STREAMS, which stands for Strengthening Relationship Education and Marriage Services, included 5 separate random assignment evaluations of HMRE programs that were funded by OFA in 2015. Each of the evaluations was designed to focus on understudied populations and program approaches not included in prior federal evaluations. Even though roughly half of the programs that receive grant funding from OFA offer relationship education to youth, until Streams, none of these programs had been included in a federal evaluation. In addition to programs for youth, Streams also focused on programs for expectant and new moms and programs that integrated relationship education and economic services. Even though we won't be touching on these other studies today, at the end of the presentation, I'll point you to where you can find more information about them if you're interested. Next slide. I also won't spend a ton of time on this slide, but as I'm sure many of you are aware, many federally funded HMRE programs offer relationship education to youth in high schools. These programs aim to fill a gap in what students learn about relationships in schools, going beyond sexual health education to also cover the social and emotional aspects of romantic relationships. Most HMRE programs for youth feature a structured curriculum that programs can purchase from a distributor, such as the Dibble Institute. One common challenge for these programs that serve youth in schools is that instructional time is at a premium, and schools may not have enough time available to offer students the full curriculum. As a result, program providers may feel pressure to shorten the curriculum to fit within school schedules, and this can involve shortening some lessons or dropping certain lessons from the program entirely. And this particular challenge was something that we wanted to address with the Streams evaluation. Next slide. In terms of the research literature on HMRE programs for high school students, prior studies have generally found positive impacts on outcomes such as students' relationship skills, attitudes, and knowledge. However, most of these studies have examined students' outcomes at or around the time the program has ended. There is limited evidence on whether programs can have sustained impacts on students' outcomes years later. There is also no rigorous evidence on whether shortening or significantly adapting an HMRE curriculum might interfere with the curriculum's intended effects. Next slide. Given this context and what we know based on prior research, our study sought to address two research questions. First, we wanted to know what is the impact of offering HMRE programming as part of the regular school curriculum on a variety of outcomes for high school students, including their relationship skills, attitudes, knowledge, experiences, and relationship quality, both 1 and 3 years after the program. And second, how does shortening an HMRE program influence its impact on these outcomes? Next slide. To conduct this study, we partnered with an organization called More Than Conquerors, Inc., or MTCI for short. MTCI is a nonprofit social service provider serving at-risk families and youth in the Atlanta area. At the time the study began in 2015, MTCI had already received 2 prior rounds of funding from OFA in 2006 and 2011 to deliver HMRE programming to high school students. Next slide. Streams focused on MTCI's delivery of the relationship education curriculum, Relationship Smarts Plus, version 3.0, in 2 high schools in Gwinnett County, which is northeast of Atlanta. And you'll sometimes see Relationship Smarts Plus referred to as RQ Plus. Rachel can correct me if I'm wrong, but I believe this is to signify that the curriculum aims to improve students' relationship IQ. The schools that participated in the study were located in communities with a large proportion of Hispanic and Latino families. MTCI offered Relationship Smarts Plus as part of a semester-long health class for primarily 9th grade students. And the lessons were delivered by facilitators who were employed and trained by MTCI to come into the high schools and deliver the program. Next slide. All right, so Rachel can hop in here to talk about Relationship Smarts Plus.
Thank you, Julia, and you are correct. So nailed the explanation behind the RQ plus piece there. So Relationship Smarts Plus is a lively 13-lesson evidence-based relationship skills curriculum for young teens developed by Marlene Pearson. And I was trying to figure out what to say about Marlene and how great she is. I do want to say she is the retired chair of the sociology department at Madison Area Technical College, but I laugh as I say retired because Marlene is the farthest thing from retired that I think you can possibly be, as she is still very actively involved in her community, still delivering programs, still working with young people, and really letting kind of their voices in the research guide the work that she is doing. And she's a real trendsetter, and we're here thanks to her creating this program. So I do want to honor her in that way. But now let's go into the program. So like I said, Relationship Smarts Plus is typically used for ages 12 to 16, but as you can see here, it can easily be used for youth up to the age of 18 and has been. And the curriculum, I just want to say, really embodies a innovative approach that addresses positive youth development. So that's what all these acronyms are on this slide here. Positive youth development, relationship education, dating violence prevention, as well as pregnancy prevention. And these goals in other programs are typically addressed separately in other curricula, but the unique part about Relationship Smarts is that they are embedded into one comprehensive healthy relationship education program. Relationship Smarts builds assets and strengthens protective factors for youth, and it does so by appealing to their aspirations rather than just emphasizing what they should avoid. So it is very strengths-based and empowers youth with the skills needed to form and maintain healthy relationships, make wise sexual choices, and work towards the goals that they have set for themselves. And in addition to the study that's going to be highlighted today, Relationship Smarts has been evaluated in other studies, and findings show that youth who have participated in the Relationship Smarts Plus program report more knowledge of healthy relationships, fewer faulty relationship beliefs, less acceptance of and use of aggression in their relationships, and even more. So I'm excited to expand on the research that has been done in today's presentation. The findings that you're going to hear about in today's presentation are from our previous version of 3.0. Like I said in the beginning, we believe in and value research. So as new research comes out, we update the program. So we have a newer version published, including new content on sex trafficking prevention, digital content and consent, and even more. If you're interested in exploring the program, you'll have to let us know in the survey at the end, and we will get you a digital review copy of that. So as you can see here too, the program is delivered entirely through activities that are informative, they are fun, and they are meant to affirm teens' relationship experiences. We use scenarios that are written by diverse youth. The program incorporates popular music, music videos, films, stories, poetry, drawings, sculptures, engaging in interactive journal prompts and dialogues. And those really help the youth apply the curriculum concepts to their own lives. So outside of the programming in schools or wherever else they may be implemented. Additionally, one more thing that I do want to highlight about this program is that there are trusted adult teen connection activities that are included in each lesson and are designed to convey the core materials to parents or other trusted adults and serve as a catalyst for having important conversations around some important issues that youth are experiencing. We know that connectedness has been found to be one of the strongest protective factors against risky behaviors, and these activities are designed to provide a way to facilitate and foster those relationships and that connectedness. So that's just a brief highlight about the curriculum and what it includes and what it's all about. But again, if you are interested, we can provide you with a digital review copy. You'll just have to let us know at the survey at the end. So that's it for me.
Thanks, Rachel. Next slide. That was a wonderful description, much more detailed than I think I could have done, and really conveyed nicely just the richness and how many different types of activities, topics, modes of learning is incorporated into the curriculum. So thank you for that. Okay, so back to the STREAM study. In this evaluation, we compared the impact of two different versions of Relationship Smarts Plus 3.0 in order to learn whether a shortened version could be as effective as the full version. So as Rachel mentioned, the full version contained 12 lessons, and it covered these 6 different content areas: self-awareness, healthy relationships, dangerous relationships, communication and conflict management, intimacy and sexual decision-making, and social media. To develop the shortened version of the curriculum, we worked closely with MTCI, the Dibble Institute, and the curriculum developer, Dr. Marlene Pearson, to decide on what to cut. Rather than delivering shortened versions of all 12 lessons, we decided to exclude 4 lessons in 2 different content areas: communication and conflict management, and intimacy and sexual decisions. We felt that cutting 4 full lessons was preferable to delivering shortened versions of all 12 lessons for a few reasons. First, it meant youth in the shortened group would cover the selected lessons in the same depth as youth in the full group. And second, cutting full lessons made it easier for MTCI to train facilitators and maintain and monitor fidelity to the shortened curriculum. Next slide. And next slide. All right, so getting into the design of the study, our sample consisted of students who were enrolled in health classes at 2 high schools in Georgia over the course of 2 school years, the 2016 to 2017 school year and the 2017 to 2018 school year. In total, we randomly assigned 61 health classes containing 1,862 students to one of 3 research groups: a group that received the full 12-lesson curriculum, a group that received the shortened 8-lesson curriculum, and a control group that received no HMRE programming. Classes that were assigned to the control group instead received a 12-lesson job readiness curriculum delivered by MTCI facilitators. And classes that were assigned to the shortened group received 4 lessons from the same job readiness curriculum after they had received their 8 lessons of Relationship Smarts Plus. The MTCI facilitators who delivered the job readiness curriculum were not the same facilitators who delivered the Relationship Smarts Plus curriculum. We did this to, 1, make it easier on the facilitators so they didn't have to learn 2 curricula, and 2, to reduce the risk of students in the control group receiving any of the Relationship Smarts curriculum. Next slide. Students in all 3 research groups were asked to complete 4 surveys over the course of the study. This table shows the timing and response rates for each of the surveys. The response rates refer to the percentage of randomly assigned students who received parental permission for the study that responded to a given survey. I'm not showing the response rates separately by research group, but I'll note that none of the response rates across research groups varied by more than 5 percentage points. And one thing that's kind of interesting that I'll share is the last follow-up survey. So we had initially planned to administer this survey during the 2019-2020 school year when all students in the study were either juniors or seniors in high school. We started with the seniors and then had intended to move on to the juniors, but the COVID-19 pandemic hit and we had to pause data collection. We were able to resume data collection in the summer of 2020, and it continued through the fall, early winter. As a result, the majority of students in our sample were seniors when they took the last follow-up survey. So you can think of this as a survey that was delivered to students, for the most part, pretty early in their senior year. Next slide. The surveys contained items related to students' background characteristics and various relationship outcomes. In terms of the outcomes we focused on for our study, they varied somewhat between the 1 and 3-year surveys. 1 year after the program, we wanted to know whether the program impacted students' relationship skills, attitudes, and knowledge. In terms of relationship skills, we examined a 6-item scale of their perceived general relationship skills and a 5-item scale of their perceived conflict management skills. In terms of relationship attitudes and knowledge, we looked at 3 items measuring their disagreement with unrealistic or faulty relationship beliefs, a 12-item scale measuring their disapproval of teen dating violence, 3 separate items about their desire to avoid teen pregnancy, and a 5-item index variable, so 5 true or false items about their knowledge of pregnancy and STIs. Finally, we also conducted some exploratory analyses to examine impacts at 1 year on students' relationship attitudes, impacts at the time the program ended on relationship attitudes and their relationship expectations and experiences 1 year after the program. Next slide. Three years after the program, we again looked at 2 measures of students' perceived general relationship skills and their conflict management skills. We also examined 3 binary variables related to their relationship experiences. These were whether they were currently in an unhealthy relationship, whether they had ever had sex, and whether they had sex without using a condom in the last 3 months. Finally, we examined 2 items related to students' relationship quality, including their self-reported relationship quality with their parents and their self-reported relationship quality with their friends. We wanted to examine 2 additional measures of relationship quality as part of our main confirmatory analyses. These were students' self-reported happiness with their current romantic relationship and their satisfaction with their current romantic relationship. However, these measures were only available for students who were in a romantic relationship at the time of the survey, and unfortunately, a smaller percentage of students than we had anticipated indicated that they were in a relationship. When we looked at the baseline characteristics of students who were and were not in a relationship at the 3-year survey, we also found that these groups differed on several other characteristics, leading us to question whether these groups were equivalent. As a result, we decided to consider these outcomes as part of our exploratory analyses rather than our main analyses. We also considered a few other variables as part of our exploratory analyses at 3 years, including students' relationship status and their relationship attitudes, knowledge, and expectations. Next slide. All right, so before we turn to our results, let me just share some descriptive information about our sample. As you can see, just under half, 47% of students were female. 87% were in 9th grade and 13% were in 10th grade or higher. These were students for the most part who just didn't take health in 9th grade for whatever reason and had to take it when they were a little bit older. In terms of students' race and ethnicity, 56% identified as Hispanic, just over a quarter identified as Black, non-Hispanic. 5% identified as white, non-Hispanic, and 13% identified as another race or ethnicity. In terms of language, 49%, half of students indicated that English was the primary language spoken in their home, and 50% indicated that Spanish or another language was the primary language spoken at home. And then 30% of students at baseline indicated they were in a dating relationship, and 15% indicated that they had had sexual intercourse. Okay, next slide. Okay, so I will hand it over to Liza to discuss our findings.
Great. Thank you, Julia. Next slide, please. So we first looked at the implementation of the curricula. An earlier process study of the program concluded it was well implemented and facilitators delivered both versions of the RQ Plus curriculum as intended. In more than 90% of cases, facilitators reported using all of the intended curriculum materials and following all of the instructional guidance in the manual. So to follow up on those findings about how facilitators implemented the curriculum, we looked at student attendance for both versions of the RQ Plus curriculum, which you can see in this table here. Students who participated in the study attended program classes at high rates. The top row of this table shows that nearly all students attended at least one class across the 3 research groups. The second row shows that average attendance rates, which we defined as the average portion of students in attendance at each class, were around 89% for each research group. As a result, students received most of the intended content. On average, students in classes randomly assigned to the full RQ Plus group received 16.5 hours of content out of 18 possible hours. Students in the classes randomly assigned to the shortened RQ Plus group received an average of 11.2 hours of content out of 12 possible hours. And students in the classes randomly assigned to the control group, as intended, did not receive any of the RQ plus curriculum. You can see that our sample sizes were also roughly the same across the three groups. Next slide, please. So we found limited evidence of impacts on students' relationships, skills, attitude, and knowledge after 1 year for 9 out of the 10 outcomes we looked at. You'll remember that from Julia's conversation that the first research question looked at the impact of offering HMRE programs as part of the regular school curriculum. So to examine that first research question, we compared students in the full RQ plus group versus control. We did find a statistically significant impact for one of our 3 measures of unrealistic relationship beliefs. Specifically for students offered the full RQ plus curriculum, you're more likely than students in the control group to disagree with the belief that feelings of love are enough to sustain a happy marriage. The limited impacts on students' skills, attitudes, and knowledge at the time of the 1-year follow-up survey reflect the fact that students in both research groups experienced improvements on these outcomes between the baseline and 1-year follow-up surveys. Next slide, please. We found no evidence to suggest that shortening the curriculum had any impact on students' outcomes. For our measures of students' relationships, skills, knowledge, and attitudes, the impacts for students offered the full 12-lesson version of RQ Plus were not consistently bigger or consistently smaller than the impacts for students offered the shortened 8-lesson version. You can see that about half of the outcomes had impacts that favored the full RQ Plus group, and about half favored the shortened RQ Plus group. None of the differences in impacts between the 2 groups were statistically significant. Next slide, please. Findings from our exploratory analyses suggest that both the full and shortened versions of the curriculum had impacts on students' relationship attitudes immediately after the program ended, but they faded by the time of the 1-year follow-up survey. Findings from our exploratory analyses also showed no evidence of program impacts on students' relationship expectations, experiences after the program ended. Next slide, please. So turning now to findings from our 3-year studies. At 3 years, our findings weren't too different from the 1-year study. We found that students offered the full RQ Plus curriculum and students in the control group reported similar levels across all 7 outcomes that we looked at related to relationship experiences, quality, and skills. Students offered the shortened version of the curriculum compared to those offered the full version of the curriculum reported similar levels on 6 of 7 outcomes. The one difference was that students offered the shortened curriculum were more likely to report having sex without using a condom in the last 3 months. However, this impact did not remain significant when using other estimation strategies or when adjusting for the total number of significance tests conducted, so it's not the most robust finding. Next slide, please. There is a possibility that the program had different impacts for different students. Previous research suggests that high school students' romantic relationship attitudes and experiences may differ by gender. So to explore the possibility that the program impacted girls and boys differently, we estimated impacts separately by their self-reported gender. We did this in both the 1-year report and the 3-year report. Here we're focusing on findings from the 3-year report because those were the ones where we found significant differences by gender. So we found some evidence to suggest that the program had different impacts on girls than on boys at 3 years after the program ended. Specifically, for 3 of the 7 confirmatory outcomes, we found a statistically significant difference in impacts for girls and boys. First, we saw that 11% of girls in the control group reported being in an unhealthy relationship at the time of the 3-year follow-up, compared to 5% of girls in the full RQ Plus group. This difference was statistically significant. And among boys, there was no difference between research groups and the likelihood of being in an unhealthy relationship. Next slide, please. Second, we found that 21% of girls in the control group reported having sex without using a condom in the last 3 months, compared with 10% of girls in the full RQ Plus group. Among boys, there was no statistically significant difference between research groups in the likelihood of having sex without using a condom in the past 3 months. Next slide, please. And finally, compared with girls in the control group, girls in the RQ Plus group reported lower average scores on a measure of the quality of their relationship with friends. So this scale ranged from 1 to 4. And on average, girls in the control group reported a score of 2.94 on this measure, whereas girls in the full RQ Plus group reported a score of 2.77. Among boys, again, no statistically significant difference between research groups on this measure. Next slide, please. So after 3 years, students also reported similar levels on exploratory outcomes. You might remember, Julia mentioned there were 2 outcomes that we had to move to be exploratory after we started the analyses. And for those, we found that students in all 3 research groups reported similar levels on these outcomes related to relationship status and relationship quality. So there was no impact on students' likelihood of ever or currently being in a romantic relationship. And among students who were in a romantic relationship, there was no impact reported on relationship happiness or satisfaction. Also consistent with the findings from the 1-year study, we found that students in all 3 research groups generally had similar levels on outcomes related to relationship attitudes, knowledge, and expectations for the future. So I will now turn it back over to Julia.
Perfect. Next slide. All right, so before we open it up for questions, I wanted to conclude with some key takeaways and considerations based on these findings for HMRE programs going forward. The first finding that we'd like you to take away from this research is that programs can reasonably expect to have impacts on students' relationship skills, attitudes, and knowledge around the time the program ends. Like prior research on this topic, we did find positive impacts on these types of outcomes at program exit. However, these impacts appear likely to fade after the end of programming. We found very few impacts on these outcomes 1 year or 3 years after the program. Another key takeaway is that the choice of 8 or 12 lessons appears to have little influence on these results. We found no systematic differences and impacts between students who received the full or shortened curricula. We also found that programs are unlikely to have sustained impacts on the relationship experiences and relationship quality of all students. However, we did find some evidence of impacts on these outcomes for girls, but not for boys. Specifically, girls who received the full curriculum were less likely to report being in an unhealthy relationship or having sex without a condom at the 3-year follow-up compared to girls in the control group. However, girls who received the full curriculum also reported a lower average relationship quality with friends. Next slide. So what does this mean for HMRE programs? Given these findings, we think there are a few considerations to highlight for programs to increase their chances of having sustained impacts on all types of students. First, programs might consider offering a greater dosage of programming, at least more than the 18 hours that students in the full curriculum group received in this study. This additional programming could be delivered during the same class or grade, such as during a semester-long health class, or it could be sequenced across multiple grade levels, such as offering booster sessions later in high school. Second consideration is that programs might want to offer relationship education to older students who might have more opportunities to apply the concepts and skills taught in class to their own relationships. It's possible that one of the reasons why impacts were limited in this study is that students in the sample were relatively young when they participated in the program. 9th graders might not have the relationship experience and context to truly understand and apply the information presented in the program. By 11th or 12th grade, many more students have experienced a dating relationship, and as a result, they might be more ready for this type of programming. Finally, programs might consider tailoring their services to certain groups of youth in order to better address students' needs, questions, and experiences. Relationship education programs in high schools are usually designed for a pretty general population of youth because providers want the program to be applicable to all of the youth that they serve. This approach makes sense and has the advantage of reaching a large number of students and potentially preventing negative relationship outcomes when students eventually begin dating. However, an alternative approach could be to tailor the programs to a more select group of youth in order to better address their needs and experiences. This logic could potentially explain why we saw more of an impact among girls than boys on certain outcomes. It's possible that the curriculum resonated more with girls than boys in our sample. However, it's just a theory, and future research should do more to investigate potentially differing impacts of HMRE curricula based on students' gender, their age, their level of experience with dating relationships, or other relevant characteristics. Next slide. So if you're interested in reading the reports that we presented on today, I've included the links on this slide. I believe you can also download them from the GoToWebinar platform. They should be listed under handouts in the platform. And then on the next slide, Liza and I also have our email addresses in case anyone would like to reach out to us with further questions. That's all I have.
Perfect. And yes, you are correct. There are the PDFs available in the handouts control panel. So again, if you'll locate the control panel, you see something that says handouts, you can download them. They will also be available as part of the downloads once this webinar is officially posted and ready for everyone to view on our website. So I think everybody was holding their questions. So while I wait for those to start coming in, I've got some from the presentation that, I think one of the great things that really jumped out to me in looking at this was the high response and retention rates over a 3-year period for surveying. So I was just wondering if y'all could talk a little bit about what you think contributed to that and maybe some ideas for folks who are trying to achieve something similar.
That's a great question. Yeah, it's really credit to our great survey team and field staff at Mathematica. They did the bulk of the work. It took a lot of time, a lot of resources, a lot of effort to get, especially that 3-year response rate where it was. It was easier, I think, for the, certainly the initial baseline survey and the exit survey. We just gave that survey to students, in their before the class started, at the first class, and then on the last class period. The 1-year follow-up, we also went back to the schools. And I should have added the schools played a big, big part. MTCI and the schools were just key partners in this work. And so we coordinated very closely with the schools to plan how to administer those follow-up surveys once students were no longer in health classes, figuring out, what class periods they might be in and how to pull students out of class to complete the surveys. At 3 years, that was our same approach. Our intention was to go into the schools and survey students, pull them from a particular class, have them come down and complete the survey. And that is what we did initially, but with COVID, we had to pivot. So we had always offered an option for students to complete the survey over the phone. But after COVID, that ended up being the main way that students completed the survey. I do believe we also sent it out by email so students could, go to a link and complete the survey that way as well. And that became a main way that students completed the survey after the pandemic hit. But we had intended for that last follow-up survey to be administered over maybe a few month period, in the winter and early spring of 2019, 2020. It ended up taking about a year for us to administer that survey.
So very impressive. I mean, all of the things that you overcame to get those numbers and to get those responses. I know that's a huge challenge in research in particular. I do want, and coming especially off of that last part about COVID, one of the questions was, did COVID affect any implementation of the program?
Not for this study. The program was implemented in the 2016-2017 school year and the 2017-2018 school year. So for the study, all of the programming was received well before COVID. I do believe it impacted the end of MTCI's grant period, that they had to pivot to virtual program delivery with the pandemic. But no, not for this study.
Thank you. And then in terms of trying to get in touch with youth for the surveying, someone asked, have you tried to reach students via other platforms like social media? And has that been effective if you've used that method?
That's a wonderful question. I believe the surveys collected information on how to reach students via social media. I'm not 100% sure about that, but I do think we, tried to ask them to share, email addresses or social media accounts so we could reach out to them that way. But I do not know if we ended up going that route and actually reaching out to them via those platforms. So I can't answer that. I'm sorry.
But it's like you had that at the ready just in case it sounds like.
Yes,
So
we had a long list of contact information at the end of the survey, so we were ready with everything in our arsenal.
Yeah, I was gonna say as many options as possible. I know you kind of started to talk about this a little bit in the presentation, but maybe if you could go a little bit more into the decision around which lessons to include in that abbreviated version versus what was cut from that.
Yeah, that was a very interesting decision that we made early on in the study. So this, and I'll back up a little bit, this whole question about investigating a shortened curriculum, the effectiveness of a shortened curriculum, was really something driven by MTCI. I believe in their grant application, they indicated that they wanted to look at this question because it was a challenge that they had come up against in the schools. And they thought it would be very interesting to do an impact study to examine whether a shortened curriculum could work. So we liked that question. And when we decided to partner with MTCI to be part of this federal evaluation, we wanted to keep that as part of the study. And so it was really a joint decision. We worked very closely with Kay at the Dibble Institute and Marlene to think about what made the most sense in terms of shortening. The two options that were on the table were primarily to either cut every lesson a little bit, try and still give the students all 12 lessons, but compress the lessons so it fit within a shorter amount of time, or to just cut 4 lessons entirely. And ultimately, we felt that cutting 4 lessons entirely was the way to go. It was just easier for the facilitators to, just not think about those lessons, to still be able to deliver the other lessons with fidelity and do exactly what they do in their full classes for those lessons, and just to skip over the content in the 4 lessons we cut. It was also a bit cleaner from a study design standpoint because we could say, like, here are the topics that students did and didn't receive, and we didn't have to try and parse out like what pieces of lessons they may have gotten. One other thing to note there is then it became a question of which lessons to cut. If we knew we wanted to cut 4, but we didn't know which ones. And we decided on the communication and conflict management and the sexual decision-making and intimacy ones because one, they kind of hung together. And so it was just cleaner to cut them. Some of the earlier, more foundational lessons are referred to again later. And so it would have been very tricky to, cut one of the early lessons. And then, when you're trying to do a later lesson, you're drawing on some of that stuff, but they never got the earlier lesson. So that didn't make a lot of sense. And then I know MTCI felt very strongly about keeping the social media lesson in, which was the last lesson. Just felt like it really resonated with students and wanted every student who they served to receive that lesson. So we skipped, I think it was 7, 8, 8, 9, 10, and 11, but then included lesson 12 in there.
Yeah, that makes complete sense. I can imagine if they're going through the program and they're like, yeah, and when we did the possible selves tree, and it's like, oh, we never did the possible selves tree. And like you said, Marlene was very intentional in the design of the program, with each section building on the next and each lesson building on the next. So you see that callback as you move throughout the program. So I could see why that decision was made, or those decisions were made. Okay, let's see, we've got questions rolling in. So I know, that we're presenting the quantitative piece here when we were going through this, but do you have any, anecdotal or qualitative kind of commentary or feedback from the youth or even their parents or guardians about Relationship Smarts Plus and how it was received?
Yeah, we do. And I would encourage anyone who's interested in that to read the implementation study, which we really didn't present on. But in addition to these impact studies, we did a very thorough implementation study designed to look at how the program was being implemented. As part of that, we interviewed youth to hear their thoughts on the program. So all of that is included in quite a bit of detail in that implementation report. Youth really like the curriculum. They find it really interesting. They really do like that social media lesson. I know from talking to some students when I went and observed MTCI delivering the program, just felt like, this isn't content that they get in schools. It's not content that that all of them get elsewhere. So giving them this opportunity to talk about relationships, talk about what they value in a relationship, and how a relationship can fit into other aspects of their lives. It is very well received by students. We did not talk to parents, I don't think, as part of the implementation study, so I can't comment on their thoughts on the program.
It's funny that you say that, because I know in all the trainings that we do, we ask, like, how many of you have ever been taught how to break up or be broken up with? And everyone's like, no. And, you hear that resounding feedback of, oh my gosh, this would have been so helpful when I was younger or when I was a teen, and even applying the skills that we're covering in trainings and how that can apply to their own lives. So that's good to hear that you're getting that similar feedback. Okay, another question, and I know, again, this is kind of like anecdotal of what might be causing these findings or what might be leading to these findings, but you saw the lower average scores on friendship quality that youth or the girls in Relationship Smarts were reporting. To me, what that kind of sounds like is some of the things that we were seeing in adult programming of healthy marriage, of adults leaving unhealthy relationships because they were able to recognize them as unhealthy. So I just want to hear kind of your take on that finding and what you think might be behind that for youth.
Yeah, our thoughts are along the same lines. We were a little puzzled by that when we saw it, and then I don't know if this came out of a conversation with MTCI or with the Dibble Institute, but in trying to think about what this could mean, we kind of landed on the same explanation of maybe after going through this program, students have higher standards for their relationships. They're able to recognize unhealthy friendships in the same way they're able to recognize unhealthy romantic relationships, and that could be driving the lower relationship quality among girls who receive the program.
Yeah, like I said, it was one of those things where I know that when we saw it, I was like, that's kind of, to me, like you said, what we were seeing in adult programming of like, what, like, why are they leaving? And it was like, that's just as important, that they can recognize when a relationship is maybe not what they deserve or high quality, or like you said, maybe their standards are being raised because of having this new information or this this new perspective, I guess, on relationships. Okay, let me go ahead here. Sorry, we see some stuff coming in. Yeah, and I guess to this, and I know you started to speak on it a little bit more, but we've got a similar question of, why you think maybe there was more of that impact for girls than for boys when you were looking at the full program.
Yeah. Liza, you haven't answered any questions. You want to jump in and share your thoughts on that?
Sure. And like Julia said, this is also certainly a little bit of conjecture on our part as well, but that, it might be that there is a maturity difference between girls and boys, that girls are more receptive to that information at a younger age, potentially. And girls are, to the previous conversation, potentially more able to recognize some of those unhealthy relationship signals and patterns because they were been able to receive that information more fully than their boy counterparts might have been in their freshman year of high school.
That makes sense. Just at different developmental stages there.
Yeah.
So I think you evaluated this abbreviated version, compared it to the full version. If someone were to say, which one, or is there a right answer? Can I do either or? What would you say in terms of how to go about it?
Yeah, I mean, I think it depends on, partially the goals of the program. I mean, certainly between these two versions that we evaluated, we did not see clear differences in impact. So from that standpoint, yeah, if it's, compelling for these other reasons to offer a slightly shorter version of the curriculum, if, for instance, a school says, I can't, get you those 18 hours that you would need to deliver the full version to students. I think this is good evidence to say that, being thoughtful and in cutting some information, students will still see the same impacts as if you had delivered the full version. But there is great content in those, lessons that we cut. And, I think also being thoughtful, just qualitatively looking through the curriculum, making sure that as a provider, you feel comfortable leaving some information out is also very important. We couldn't look at everything in the study. We didn't do a deep dive into every possible outcome that may matter for programs, for students. So, I would say there's good reason to think it's okay to do it shorter, but be thoughtful about it.
Isn't that the hardest part of a researcher, being a researcher? You're like, I want to answer and ask all of the questions, but I can only do so much with what we've got here. Okay, I think we've got one question left that we can close it out on. We'll see how quickly you answer this. Maybe we can get one more. But a question about the programs, and I guess this goes back to implementation. Was it consecutive days? Like, how much time was there in between each lesson that was provided?
Yeah, I think it tended to be 1 or 2 days per week. It was not consecutive days. They delivered it over the course of a semester. For the most part, it lasted the full semester. So I think I'd have to go back to the data on this. I think the intention most semesters was to deliver it 1 day a week, but then sometimes there was testing or there were, institute days, and they ended up having to reschedule and come in for 2 days in a given week. There may also have been one semester where things got started a little bit later in the semester, and so they just right away went to a 2-day-a-week model. But yes, that was general. It was 1 or 2 days a week.
I think that's just par for the course, right? Nature of the game when you're working in schools, there is so much that can come up that needs or causes the need to shift. So, okay, we are at the tail end. I do want to say anybody who has questions that maybe we didn't get to, don't worry, we will get to them. We will follow up with you and make sure that your questions are answered. I do want to say thank you so much to Julia and Elizabeth for being here with us on this Wednesday afternoon and sharing your findings and just telling us kind of all about how this was implemented and how you made such a successful study over such an extended period of time. So thank you both for being here today with us. I do want to take a quick moment to just let y'all know what is coming for the next month's webinar. Again, thank you everyone too for being here with us today. Like we said, the webinar will be posted and available, including all of the handouts that are included in the handouts. You can find it on our website. We'll also send an email when everything is posted. If you have questions for us at the DIBELT Institute, you can email us at relationshipskills at dibbletinstitute.org. If you would like a digital review copy of Relationship Smarts Plus, let us know in the survey that you will get when we sign out for today. And then next month, make sure that you take a look for our webinar November. I don't have the date off the top of my head because I don't know what that Wednesday will be. Thank you, November 8th. Like I could try, but I would probably get it wrong. So November 8th, Capture and Motivate, Reigniting Youth Collaboration and Engagement with Be Busy from Texas. So look for that. And otherwise, we hope you all have a wonderful rest of your week and rest of your Wednesday. And we'll see you next month. Thanks.
Thanks.